what if the real medicine is not found in a pill bottle, but in a small human act that we seem to have all forgotten, and that is listening. And you see, real connection cannot happen without listening. And without connection, healthcare starts to fall apart. And in my 25 years of practice, the number one thing that patients complained about or said to me again and again was, nobody's listening to me. And that stuck with me, because how can we make a right diagnosis or give the right treatment if we don't stop? So when I think back to my childhood, I remember how painful it was not to be heard, to be ignored, to be dismissed, and even to feel like my voice didn't matter. And even though I couldn't name it back then, that experience planted a seed in me. And that is the reason I became a nurse. And eventually I became a fierce advocate for people, because I knew, even as a kid, it is not okay to be dismissed. People deserve to be heard. And here's the thing, listening and connection are not just soft skills. They are the foundation of care. So during my many years in care and working as a nurse, my last public job as a nurse practitioner was in a walk-in clinic. It was a really busy place. We'd see 30, 40 people a day, and the staff was mostly nurse practitioners. And we built ourselves a reputation for listening. And so it wasn't uncommon for patients to come to us seeking answers. And I will never forget this one woman who sat across from me. She had 3 prescriptions from 3 different clinics for the same concern. And she said, Diane, like, nobody's listening to me. So I said, okay, let's set that aside and let's start over from the beginning. So I sat down, gave her the time she deserved, and I listened. And once I took the time to listen and hear her story, the diagnosis actually became clear. She left with a treatment plan that she trusted, and that trust made all the difference. Because when people feel heard, that fear, that uncertainty, and that chaos completely settles, and the healing can then begin. But when we don't listen, that creates stress. And in healthcare, stress can cost people their health. And so after a while in that very busy setting, I just felt like I couldn't keep doing this anymore. And I wanted to provide the kind of care that was truly patient-centered. So I did something that most people said was crazy. I walked away from my supposedly stable union job. I walked away from my retirement plan. I left it in the dust. And I launched a mobile clinic out of my RAV4, and I called it the Nurse Practitioner on Wheels. So what I did was I went from house to house. I would see people across at their kitchen table. I would see them in their offices, and sometimes I would even see them in my vehicle. And you know what? It worked, because as it turns out, you don't need to have super fancy giant clinic or fancy technology. You just need to listen. Of course, being a pioneer, starting something new like this in Manitoba meant facing a lot of resistance and challenges. So for example, I had trouble getting the labs to accept my samples. And so I had to advocate all the way to the head of the lab department in Manitoba in order to provide these basic services. Despite the challenges, I kept going. I had the conviction. So, when you're doing something that you know is right, it just keeps you going, even when it's super hard. And every single patient I saw taught me something new. And keep in mind, I was now seeing the system from the outside looking in, right? And so I discovered something shocking. There was a number of things, but this one particular thing was over 70% of the patients that I saw had at least one or two stories about being unheard or dismissed by the system, either for themselves or somebody really close to them. That's 7 out of 10 people. So what should we call that? Communication problem? Well, for sure, it's a listening problem, right? And have you ever been dismissed in your most vulnerable state? Hey, we're vulnerable as kids, but we're also vulnerable as patients. So I'll never forget this one family that reached out to me. They said, you're our last hope before we go to the Mayo Clinic. And I was like, Mayo Clinic? What? Okay. So I went into their home, and there I saw it. The table was covered with binders and test results and prescriptions and just research. And there was blister packs that were overflowing with pills. There was antidepressants and sedatives and painkillers. And I was like, oh, this family was so exhausted and desperate. So I said, okay, let's leave all this and let's go sit down. And I listened from the beginning, and they told me their whole story. And once I heard all of that in order, I could see the big picture. And it wasn't that the diagnosis was impossible. It was that no one had taken the time to truly listen. So that day was a massive aha. Like, my heart skipped a beat. I was like, oh, like, it shaped everything moving forward. I realized it is true. The real medicine is not pills or procedures or specialists. The real medicine is connection. And connection begins with listening. And I didn't just make this all up. There's actually science and evidence behind all of this. Because I remember a few decades ago, when I was in nursing school, I learned all kinds of really cool evidence-based frameworks like population health principles and appreciative inquiry and patient-centered care. And I remember all of those theories and processes were incredible. And I was totally a believer in them. And every single one of them pointed to the same truth. When people feel seen, heard, and we can tap into their strengths, their health outcomes are better, right? So all of these years out in the real world, I couldn't figure out why nobody was applying these principles. So I decided, that's it, I'm going to bring these theories into practice. And so that's how I created something I call the Listen Framework. And this is a way to transform healthcare from the ground up. So let me just break it down for you really briefly. So each letter in the word listen stands for a step. So L is for listen. This is where we really listen, not just for the words, but what's for behind the words. I is for involve. This is where we involve the whole person. It could be their stressors, their family, all the aspects of their care, their community. And S is for strengthen. So we build on what's working. We honor the person's strengths and their values. So that's the first 3 steps, right? And as Stephen Covey says, seek first to understand. That's the first 3 steps, right? So the T now is for take aligned action, meaning we don't just prescribe, but rather we collaborate. We work together to come up with a treatment plan. E is for evaluate. So we look, what is the impact of the treatment? What is the outcome? And N is for nurture. Now, keeping in mind this listen framework is a circle, so it never ends. So nurture meaning that you follow up, you stay connected, and you treat healing like a living process. And then I realized as I put this all together, this is what I had been doing all along. And it worked. And it's not because I was super smart or had fancy tools or some fancy technology. It worked because I slowed down and I listened. So let's just take a moment to imagine, what would our healthcare look like if every single person felt heard, if they felt cared for, if they felt protected, if they felt like you were advocating for them, and they felt like their concerns were super important? What would our healthcare look like if it was like that? What would our communities look like if we truly listened to each other, if we slowed down and truly listened? And what would you feel like if you really stopped to listen to yourself? Because here's the truth. Healthcare always talks about funding, right? Well, we can't run out of funding for listening. So today or this week, I invite you to do one small thing. Choose one person, one conversation, and truly listen. Because connection is the medicine the system forgot. And it begins with us. Thank you. Truly listen. It's not working.